So welcome to Mental Health Monday, November 24th. Um, our topic is supporting rural and frontier maternal whole health. We've got a panel here that we'll be introducing. Discussion will include access to specific care gaps and how to bridge them, how and where to voice needs. Um, so uh, I just want to welcome everybody. I know I got a lot of emails when I sent this out this morning saying that people are out on vacation for Thanksgiving week. So extra thank you to those of you who made it. I'd like to start by introducing the panel members. And you did see on the flyer, Trish Reiner is listed. Unfortunately, she is out sick and will not be able to be here today with us. But we do have let's see, Danny Vince is here. And Danny is the program manager of care management at Arizona Complete Health, and has been with that since 2018. She conceives, implements, and manages innovative programmatic and community-based initiatives designed to improve both member and provider outcomes. In this role, Danny leads cross-departmental and cross-system teams, oversees special projects, and provides administrative leadership for the maternity care program, driving early access to prenatal care and supporting optimal birth outcomes. Danny is highly skilled in developing project plans, establishing baseline data, analyzing and reporting outcomes, and ensuring the successful completion of contract deliverables. Driven by a commitment to improving health outcomes and strengthening care delivery, Danny leads with purpose, collaboration, and dedication to meaningful and measurable impact. So thank you, Danny. Would you like to add anything to that introduction about you?
No, I think I have a strong background in public behavioral health over 25 years in the space and have been with Arizona Complete Health and overseeing the maternal child health program for probably about 8 years. So, thank you.
All right, and thank you. Kate, I'd like to introduce Kate Taylor. She's the Regional Director of Clinical Outreach for Charlie Health. And Kate, if you'd like to provide a brief bit of information about you and your background in Charlie Health.
Sure. Hey, everyone. My name is Kate Taylor. I'm a social worker by education and formerly by practice. Operate on a more meso level now through my role. Charlie Health, for the context of this particular Mental Health Monday, does have a maternal mental health virtual intensive outpatient program. One of the things that we saw a huge need for as we served many different states was one of the leading causes of suicide post-birth is unfortunately or sorry, one of the leading causes of death post-birth is suicide amongst mothers, especially in rural and frontier areas. And so we recruited clinical expertise and provide programming that is more accessible to these individuals. Yeah, I don't know. I don't like talking about myself. I love this work. I live in Flagstaff. I've covered Northern Arizona for several years, but now cover a lot of our rural portions of the state and oversee our outreach team. Um, yeah, who are doing the boots on the ground work, working with providers who are seeing these needs and helping connect clients to care. So that's just a small tidbit, I guess. Hopefully that's helpful.
Okay, thank you. Thank you, Kate. Susie Salvo Went, would you like to provide us a little introduction about yourself? I know you are the Grants and Telehealth Manager at Summit Healthcare Association.
Yes, ma'am. And I'm so thankful to be here. And so my background comes from being at Summit. We had a grant and we focused on maternal and infant care. Uh, uh, and we have a program called Aspire, which is the alliance supporting um, parents in recovery and need. And so with that program, we've been able to provide peer support services, a parenting peer. And we have over 112 referrals, with 52 still engaged. And so we're so psyched, and I'm so dedicated, um, because myself, I come from a background where of violence during my maternity, and so this is very important. Thank you.
Thank you, Susie. Brenda Rapogal, you are the Peer and Family Support Advisor of OIFA, Office of Individual Family Affairs for Arizona Complete Health. What would you like to share with us about you?
Hi, everyone. Well, I love the birth to five range. That's one of my specialties. I personally was a failure to thrive child in the early phases of life. So I love everything to do with maternal, child, and health and wellness. And so I work as an advocate, a youth advocate, as well as a CRS member advocate, which for those that don't know what CRS is, it's the children's with like special chronic health care needs, very fragile physical health care needs, and then known as Children's Rehabilitative Services in the state of Arizona. And so I provide advocacy for them. And I have worked in the behavioral health field. I've worked at Arizona Complete Health for the last 10 years. And then when I was working in the field, I did family support and one-on-one direct support with youth. And that's it for me. Looking forward to our discussion, everyone.
All right, thank you, Brenda. And last but not least, Carol Knudsen, who is in for Tara Sue Honey. Carol, if you would like to share with us what you are doing with Cherished Families and where you're located.
Hi, I'm Carol Knudsen. I'm Northern Arizona. It's actually right on the border of Utah and Arizona. Cherished Families provides housing support, advocacy, peer support, therapy. We help primarily families with polygamous backgrounds to get set for generational success. I am family peer support in Utah and Arizona. Just glad to be here.
Thank you. And that family peer support is such a crucial piece for helping people in all arenas. Now, I want to share with you that Deb Jorgensen, who is with the Office of Individual Family Affairs for Arizona Complete Health and has been for how many years, Deb, would you like to say?
I have been with OIFA. I started with Care First in 2018 and became a very happy team member of Arizona Complete Health 2.5 years ago now, I think.
Okay.
And yeah, I'm a
Yeah.
peer. This subject is close to my heart as someone who ended up in rehab at 5 months pregnant with my son 40 years ago. And it's it's something that support is needed and care and we're doing some wonderful programs in Arizona and I'm really excited to talk about them today.
Right. So Arizona Complete Health sponsors the NAMI Yavapai partnership with Northern Arizona Peer and Family Coalition to do the Mental Health Monday program. And Deb has put together a PowerPoint to get us started on this topic and provide us with some information. So Deb, I'll turn it over to you to share your PowerPoint, and anybody has questions as we go, either put them in chat or raise your hand and unmute yourself. So here we go.
Yes. Screen share. I'm not sure why that's all there. Okay. Can everyone see my screen?
Looks good.
Okay. this is what Lori said. Welcome, everyone. And this panel discussion purpose was really to share insight on maternal and child health here in Arizona and from our different providers and different perspectives in the system of care. We want to identify some community-specific strengths and resources and also identify current unmet needs. We will discuss opportunities that could close gaps in care, and lastly, how OIFA can help advocate for you and your members. And this is just a little bit of the data that we had pulled together. And one of the pieces that's so concerning, of course, is the higher rate of maternal deaths in comparison to the national rate, and the highest rate of severe maternal morbidity in Arizona. It looks criminal to me, but anyway. And then we go on to American Indian and Alaskan Native, the maternal mortality rate, which is huge and something that can be addressed. And we have 3 counties that have limited access to maternal care, and Greenlee is completely a maternity care desert. So basically, we've got very high vulnerability in Apache, Navajo, and Gila, and severe maternal mortality for our Black or African American population statewide. And I'd just like to ask the panelists, do you have any additional data or insight from your community's perspective?
This definitely coincides with what we're seeing in our service area, Navajo, Southern Navajo and Apache counties.
Thank you. Anyone else?
This is Brenda, and just speaking of deserts, uh the I was born in a very rural area, so getting access or quick access to any type of health care um, was very hard to do. And then to be able to have a baby in the hospital, but then also to get the post and prenatal care, the before and the after the birth was very difficult. Lots of it due to transportation or the lack of transportation. And then even now, I mean, that's like, I don't want to say my age, but that's more than 29 plus 38 months ago, more than 40 years ago. Okay. And right now, this data is 2025 data, and there's still deserts when we're talking about like healthcare deserts, like that there is not enough OBGs or different types of doctors. There's not enough transportation or whatever that might look like within when we're talking about a desert. So I just kind of wanted to, I'm just standing in awe that we are, 2025, and still experiencing these deserts.
I can jump in. This is Danny with Arizona Complete Health, and we have been meeting. We have an internal work group that's specific to prenatal postpartum, and one of the topics that we focus certainly is the maternal mortality and morbidity, as well as health equity and having that focus. And so we are looking at data on a regular basis as far as the breakdown of race, ethnicity, and language within our population, and definitely how that data feeds into the initiatives that we pursue. And one of our goals for our health plans network development plan for 2026 is to expand maternity care services in the North. And so we're working collaboratively within the health plan across departments, including care management, contracts, network operations, our tribal liaisons. We partner and they are part of our prenatal postpartum work group to look at enhancements for outreaching our population in the North and really across our service areas. So I don't want to take up too much time talking about the work group, but it is definitely a focus area. And is a brain trust within our agency, and we have OIFA participating in that as well. And actually, that's what brought me to today's event. So yeah, and I'm sure as we go through the PowerPoint and today's forum, be talking more about some of our efforts in that space.
Thank you. Anybody else have anything to add on this one?
This is Kate from Charlie Health. The only thing I would add is like I live in Coconino County and I can tell you we have two OBGYNs in Flagstaff in particular. I mean, more than two exact providers, but two practices. And I have commercial interns and we have one practice, our main one, that actually no longer works with United Healthcare. So I think just across the board, unfortunately, there's a big shortage in providers that are really specialized and also can afford to live in the areas where there is immense need. So that's just some context. That's unfortunate, but hopefully changing. But 2 cents to share.
Thank you. And I know there were some poll results that came up, lack of appropriate providers in the area, which was just spoken about, fear of possible consequences of seeking care. We have distrust in providers, very long wait times to see a provider, limited to no transportation, just not enough providers. Member may not be insured at all or they're underinsured. And there's a lack of childcare for those with young children who are, seeking support as well. And I'd like to ask the panel, what are some of the reasons you see in your communities? Carol, maybe? Want to start? We just met with the community in Colorado City and had a great meeting and had participation from moms in that community.
Yeah, we had a couple of moms show up to the meeting, and a lot of them came because they wanted to discuss how hard it was to even get the insurance because of a particular DES worker that comes across really accusatory. I don't know what all we need to do about it. I think we're going to figure out a way that they can file a grievance. Me and several of my clients have had a particular confrontation, I guess, where this specific individual has grilled them and made them feel so horrible that they'd hang up the phone and cry and say, I don't even need SNAP benefits if this is what I have to go through. Anyway, it's one particular individual, it's not the entire system. Until we can get that resolved, I think that's kind of what's our barrier here.
And that's a very specific barrier. I know other barriers were providers in the area, specialty providers. There was a discussion of seeking care for loss of hearing, hard of hearing for their child, and how there are providers within reach, but they're in Utah, and being required to use providers that are contracted with us in Arizona creates a really hardship for transportation, for time off from work, childcare, just a myriad of barriers to actually getting some support.
Yeah, a lot of the specialty providers are clear in Flagstaff. And for us, that's 4 or 5 hours away. And so if it's just a follow-up appointment, it's really hard to get moms that have lots of kids to figure out how to go to Flagstaff for a simple follow-up.
I mean,
There's only two.
this is Lori. I have a question about that. When we have such a frontier and rural area that is so many hours away from the specialty providers, is anyone looking into clinics on a quarterly or monthly or some kind of basis where they come to you, or is that just unfathomable?
No. That was actually part of a discussion 2 days later over at Creek Valley Health, and they're an FHQ. There, I left out a letter there. FHIQ? I don't know. Somebody knows here on this panel. But
FHC, federally
yes.
qualified health. Yeah, there we go.
Thank you. Thank you so much. And so that was a topic of discussion on bringing in specialty providers. Can you all hear that? That's my dog squeaking a toy.
We can't hear the dog.
No.
Oh, thank goodness. Okay.
You.
He's squeaking it hard. So that was part of the discussion and something that they are looking into for for that particular area. Susie, how about over on your side of the northern state?
Well, we've got OBGYN, and we deliver between 750 to 850 babies a year. We were down to one OB this year, and we were in a desperate situation because he couldn't do it all, and his mental health. And so we really got into this very scary situation. We were able to bring in locum tenens to help us, but they're not dedicated to the community. They cost a lot of money. So what we did, seeing such a high need, is we changed our medical executive committee rules and logistics that we would allow midwives. We had never credentialed midwives. So now we are in the midst of bringing midwives on. We also had to look, there's hospitalists who are your general doctors in the hospital, but now there's an OB hospitalists that we brought in. And so absolutely lack of providers. And then providers who look like the community, because that's the trust, or even nurses. So when we brought in a peer support specialist from the White Mountain Apache tribe through Hope, they were able to find Sheena. It changed the whole atmosphere of how we were treating patients. We still got a lot of stigma to go, but having that one parenting peer from the White Mountain Apache tribe as just she's getting self referrals now. And so we're trying to look bring in people who look more like our patients and who are more understanding of where our patients are coming from and their social determinants of health. And so we could have lost it all, but, you know, thank God we were able to find and we were able to broaden with midwives. And so we're very excited for the future.
Thank you. And Kate.
Hi. What to add here? Uh, I mean, I think that there's a variety. I think awareness is also part of this still. Like stigma is always something we have to chip away at. It is very scary. I am not a mother myself, and I have many, many new mothers in my life. But it's definitely difficult to say you need help while you're also bringing potentially like the most important part of your life into the world. And what the fear might be. There's still a lot of removals happening from DCS for mothers that have substance use disorder, which is also really challenging, even if you're in an active change, kind of like interested in recovery or in recovery. I just think that there's a lot of stigma. Whether or not it's mental health or substance use, I think both things go hand in hand because people are constantly evaluating you to make sure that you're going to be fit to take care of this human you're bringing into the world. I also I mean, from my perspective, being at Turley Health and the reason we exist, like the most important piece is just accessibility. Do we have quality providers that are truly trained in this area of perinatal mood and anxiety disorder or postpartum depression or either of those things with concurrent substance use, who are available in a network with insurance? We do at Charlie Health is one of the things we believe really strongly in. But um, I know that that's just there's so many niches to that. Like finding that in an accessible format for some of the communities we serve is just not always easy to do. So I don't know if I helped answer the question there. That's just what came to mind.
Kate, this is Lori. I have a question because your services are virtual and we're looking at communities that are frontier and rural. When internet access is a barrier, what is being done to help them connect with you? Are there doctor offices or other providers um, linking them with you through internet?
Yeah, it's an excellent question. I would start by saying actually you'd be pretty shocked at the internet accessibility across rural Arizona. It's not quite as bad as you might assume, and I have a lot of firsthand experience living on the road out here. So there's that, but as a company, there's something that we do, which is we provide a tablet for patients that need it. So if someone does not have a device to log into virtual care through, that's something we can provide um, through our organization. And then as a social worker, one of the things I knew was going to be essential because when I took this role, I was also concerned about connectivity and the ability to access care just through internet. And that's just where partnership becomes so crucial, right? So if I'm working with a school or a hospital or a behavioral health home, wherever the case might be, I mean, we're constantly evaluating what community partners exist locally that you can get to tap into their Wi-Fi and be able to log into services. Do you have a community network? I mean, we work with social determinants of health. We also think about things in terms of the system. So we're constantly evaluating like who in your life is supportive and like where can we problem solve to help you get access to care. But oftentimes it is through partnership where someone has a safe private location or just the ability to tap into Wi-Fi and log in. So we've seen some pretty good outcomes from that, but it's not perfect. There will be people where that's still going to be a total barrier, but I haven't seen very much of that, if really any, in the last 2.5 years. So I think through community, we've been able to work through that.
Okay, thank you. And I want to welcome Tara Sue Honey, who has now joined us. She's the program coordinator for Cherished Families. Welcome, Tara Sue. And I want to mention that Jen Cohen with DeNova. Jen, would you like to unmute yourself and share what you have as far as resource?
Yeah, sorry, it took me like 3 clicks to turn my video back on. So DeNova Collaborative Health is another virtual option. We offer traditional like 1-hour appointments in counseling and psychiatry. We do have clinicians that specialize in perinatal mental health and postpartum depression. And for access patients, we do have same day, next day appointment availability for virtual care. We do accept every single access plan. We serve the entire state of Arizona. We're a local company. Like I said in the chat, we have over 150 therapists and over 50 psych providers. And we're able to see ages 4 and up. So back to, the stigma around, maybe using substances and such during pregnancy. We're here in a non-judgmental way to support these individuals through their journey to help them be as successful as possible.
All right, thank you. And Deb, back to your slides and
Okay. Okay, let's go on to our next slide. And this was just something that showed how we have a higher rate of health insurance, lack of health insurance. It's almost 10%. And 46% of the counties have a higher rate than Arizona overall. And Apache Navajo in our northern Arizona, and then quite a few of the counties in southern Arizona have really high rates of lack of insurance. And Danny, I did have a couple of the initiatives that are being shared or developed for 2026. And would you like to speak a little bit about that?
Absolutely, sure. So our focus for many years continues to be increased access to timely prenatal and postpartum care. We currently offer incentives, member incentives. One is through My Health Pays. It's a $50 reward to a member who completes their initial prenatal appointment within the first trimester, or 42 days of enrollment with Arizona Complete Health. I can share that information in the chat. I can and send out the flyer, the information. We also have an additional incentive that just rolled out to include we're partnering with Tenderheart to provide members with either their choice of a pack and play, a car seat, or stroller. The piece with that incentive is we need to have a notification of pregnancy on file with the health plan, and then also that initial prenatal care appointment within 42 days of enrollment or the first trimester. Our focus in that area is with the thought that if members, we can support members to get connected to care as early as possible in their pregnancy. We'll see that follow throughout, including postpartum. So we're excited to have those incentives and get the word out. Would love your partnership to spread that word. In addition to that, we are looking at, kind of going back to that provider piece. We're exploring for 2026 a variety of different payment structures for OB providers in hopes that that would increase access and availability. And so that might be provider incentives, pay for performance in that space as well, like value-based contracting. Also exploring providers who may have mobile, the ability to provide those services on a mobile basis, given the challenges that we all just spoke about. So we're excited to see where that goes for 2026 and hopeful that we can make some impact there. I know that there was also a question about doulas that Brenda posed in the chat. And so given that Access approved doula services and created a new provider type as of 10/1/2024. We have at Arizona Complete Health also been focused on expanding that and looking at opportunities and partnering with a variety of other entities in the community that provide doula services, absolutely seeing that value. And so I know that with any new, provider type and billing codes available, it certainly takes some time to build more of a robust network. And so also working in that space to increase awareness. And as I said, with some of those agencies that we've made contact with in the North that have doula collectives or are using grant funds to provide doula services, working to support their efforts, partner, perhaps connecting them with community reinvestment funds through Arizona Complete Health, if that's available, or as that's available, to be able to expand their reach in that space as well. So I could probably go on, but I don't want to take up too much time.
Thanks, Danny. Tara Sue, I'm sorry, we all introduced ourselves at the beginning. Would you just like to let everybody know what you do out there at Cherish Families and in your community?
Sure. I'm Tara Sue Honey. I'm the program manager for Cherish Families, and I work out of our Colorado City Hilldale office. And I get to work with Carol and Taylor, who are both on this meeting with us today. And we work in the border town. And should I tell what services we provide? Kind of what we do, or
Please.
did I already do that? Okay.
Go right ahead.
So we serve those from plural family backgrounds. We have victims advocacy, and in that we provide court support, protective orders, legal. We can help with a lot of different things with victim advocacy. We have family peer supports, and they're certified in both Utah and Arizona. And we are working on an opioid grant, so we're bringing in new recovery resources and working on finding what's already there and providing new services. We have the food bank. We work with St. Mary's Backpack Program and have basic needs of all kinds, from clothing, hygiene kits, different things like that. We also provide adult education through one of our programs, and off the top of my head, I don't know if I missed anything, but that's basically what we do. We serve the community however we can, and we find resources when we don't have them available.
Harrison,
Extremely resourceful.
This is Lori. I'm just curious, how many do you serve?
Oh gosh, what do you mean? In a year, in a month?
Whatever you want to answer that. Just give an idea of how many you're working with.
Gosh, well, Carol right now, she has, I think, over 50 students in the adult education program. Our victims advocacy, well, I haven't looked at our numbers for like the last year, but with our food bank numbers, it's around 15,000 people a year, between 15 and 20 that we serve. And then I'd have to look at all the numbers. We also provide therapy. So we do serve a large number of people. But I can get better numbers for you, and I will get those to you, Lori.
Well, that's great. It sounds like you are serving a substantial number of people, and we've talked about stigma a little bit, and it sounds like even with stigma, you're getting a lot of people in the door.
Yes, yeah. A lot of our staff they have lived experience, so they bring that in working with our clients, and we do a lot of training around cultural sensitivity with our therapists. We have a 6-hour training that they go through, and a lot of the law offices as well. And if anyone's interested in it, I can send you the video. We have 1 hour and we have a 6-hour, and it's really helpful in working with the population that we serve.
Thank you.
And Cherished Families is just it's a gathering place in the community as well. For our holidays, I saw you putting out things for Thanksgiving and the Christmas tree piece.
Yes.
Every year, there's a lot of building community and community support for a population that's you know uh, have experienced such a great change and navigating that and I just cherish families is just this rock in the middle right there.
Thank
And
you,
that's
Deb.
something that this is Brenda. Something that was on a previous PowerPoint is what is your community's strengths and how do you utilize them? And I think we just got a great example of that community strength from you, Tara.
Thank you. We do also teach different classes. We teach love and logic parenting classes and healthy relationships, mindfulness, and then financial literacy. So we've got money matters classes. We have those every month. The parenting is every week for 6 weeks, and we offer it 4 times a year.
So there's a lot happening at Cherished Families. And two, since 2019, I think we were just looking at Creek Valley and how that expansion has happened. They've gone from this it's just expanded from I think 17 employees to 52 now, and they've got behavioral health, they have nutrition, they have physical rehabilitation, I think, and just constantly looking, oh, dentistry. They brought dentistry to the area, which was an amazing thing. Um, I think as a system, focusing a little more on prevention would save us a lot of money in the long run. Not just dentistry, but almost anything. But that's, I don't think I have a slide on that. But what other opportunities would you like to have? What would you all like to see addressed for your communities? Um, what is something that if you had a magic wand, this is the magic wand question.
I'll go ahead and speak. By far, getting the behavioral health and mental health services, whether they're through telemedicine, in person, if we can, is huge because I know 2 programs that we're doing um, is in our NICU, which we just got level 2 certification. We brought in a NEST program, and it's based on the Phoenix Children's Hospital of helping parents with preemies or babies born with uh, positive for NAS. Our therapists are working with parents and those babies before they leave the hospital. And then what our Healthy Steps program has taken over is doing the postpartum depression screening 2 to 3 weeks after the birth of a baby. So, but these are hard. They're great programs, but funding is always hard. And so I think we have great ideas. It's just how do we build this out so that it can be replicated to help other systems?
I have to share, Susie, with the story that you were just talking about. This is Brenda again. The nurses, I have twins, and they were both preemies, obviously. They were born at 3 pounds. And I was terrified to see them, to touch them. And the nurses became like a second family. Like they taught us everything, how to hold the baby properly, how to, even if they were like tube feeding, we got to press the tube and how to bathe the babies. And it was just like, I cannot even imagine trying to bring home two infants and put that type of care without those nurses, like, the demolishing stigma, not making me feel bad for not knowing anything, but really embracing as a new, like, biological parent, and walking through those processes and like sharing those special moments was made such a huge difference. Like I just kind of reflecting on that experience. And when I went home, I missed those nurses, and I said, "Oh my gosh, can you imagine?" But anyways, yeah. So love that, where the nurses are like spending time with the families and teaching them how to do things that you would think, oh, well, that's just Mother Nature. You should already know how to do that. And it makes a world of difference.
And two, I think I'm so sorry that Trish was out today and not able to join the panel because they work with the courts in Yavapai County to for family reunification, for family staying together, and supporting parents who are, who are DCS involved. Yeah,
I was going to
Department of Child
mention that
Services.
earlier. Yeah, when you had talked about stigma, the SHIFT program is available and across all counties, and that's something that as a health plan, we've participated in with SHIFT and kind of that expansion. Oh, perfect.
There it is.
I'm just wondering, Deb, if we can learn a little bit more about Start Smart for your baby or the SHIFT. Here's the Nest program.
And the Aspire for support of families with substance use.
Yeah,
And this one is
go ahead.
Oh, this one is just right on our Arizona Complete Health website. But I was just gonna see if Danny wanted to kind of go into it a little bit more.
Absolutely, yeah. And so within the health plan, we do have a dedicated team for our maternal child health population. So it's made up of several care managers. So we have staff with who are both nurses, have experience in labor and delivery, as well as those with behavioral health background, social workers, and care coordinators. So that's, as I mentioned earlier, we really highlight that notification of pregnancy to the health plan, and it can come in various forms, whether it's through provider, the member can complete that themselves, and that just helps alert us at the health plan that an individual is pregnant, and initiates our outreach to them within the maternal child health team to support them and let them know that the health plan is available to provide resources, connect them. One of also the benefits through the health plan, we can provide breast pumps for moms who want to breastfeed, and that's at no cost to them. Once an individual is pregnant, we're sharing key information through Start Smart for Your Baby. So ultimately, that model is a best practice and really focuses on early intervention to reduce, very low birth weights and really promote positive birth experiences and outcomes for the baby. So looking at from beginning to a pregnancy through that first trimester. So a lot of great information. As you can see, this link connects with our website. And so there's a variety of resources and information available there. And really just our staff supporting that individual throughout their pregnancy, assessing for postpartum depression, perinatal mood disorders, providing resources in that space, supporting individuals getting connected to behavioral health providers, looking at telehealth resources, other community resources. Also, as we talk about more high-risk populations, such as members or individuals who struggle with substance use, wanting to ensure that we are connecting with those individuals, providing support, non-judgmental. We have a number, our grants administration team at the health plan has great partnerships across communities with a variety of programs to keep mom and baby together. We work closely with Jacob's Hope and Hushabye, who work to, although they're located in Maricopa, but work to support other counties across the state as well. Gosh, I could probably go on and on, but hopefully those are kind of our highlights. Happy to answer any questions or provide additional information.
Thank you, Danny. In the chat, Kate, you talked about Charlie Health, where you have postpartum doulas and lactation consultants, and your primary therapist will request them to join individual therapy sessions for support if appropriate. And I assume that's when you see a mom who might just be struggling with whether it's mood, whether it's hopelessness, etc. Do you want to share a little more about that?
Sure. So there's really in the sphere of maternal mental health, right? We have two specific curriculums or tracks that we follow through our virtual intensive outpatient model. So one of them is our perinatal mood and anxiety disorder model, or PMAD, as it's known, or PMH actually, perinatal mental health. I think they've tried to move away from PMAD, which is fair. So for that track, for our clients that are enrolled in the program, they have access to this level of care. All of our clients will work individually outside of their group-based therapeutic interventions every week with the same therapist for an hour. And so as needed, we just bring these individuals, their staff members we have on our team to support, right? We know that there are so many different factors that come into what the challenges of like maternal mental health bring along. And so having folks that can walk you through frustrations, like I have someone on my team that recently had a baby and had to have a C-section because baby was breech and is really, really struggling with breastfeeding, which is also like just another disappointment in that birth journey. And so for us, like one of the big things is like we know that sometimes birth can be traumatic, and so that's a whole experience in and of itself. So you now have like such a huge life change, and you have a formative trauma that happened alongside of it. So this is just something we offer. I don't know how in depth you'd want me to go on stuff, but we had the program launched in December of 2023, and we ran the program. So this part of our programming launched in August of this year. So for almost 2 years, that was just a consistent need we saw, and so we basically brought in these specialists to support along the process.
Oh, that's great. Thank you. Is it Sabbath? Did I pronounce your name correctly? I hope. Um, uh, Shared in the chat that Yavapai County Community Health has a home visiting program, Health Start, for prenatal and postpartum moms and families. So that's another resource. And we are gathering what we're hearing here as well as what we've already got on slides and make sure that those resources are shared with everyone who participated today.
And I think I just kind of want to bring, this is Brenda. I was, as I was thinking about, like, you know, watching my sisters have their many children, and then when I had mine, it was so different. I just thought like everything was going to click the way everything, clicked for them. And the truth of the matter is, speaking, through the lens of the birthing process, is that your each child or each pregnancy can be extremely different and might need different care. um and you may have just breastfed perfectly for one child, but then another child, it's just, something's not clicking right. You might need the lactation support or whatever that might look like. And just kind of thinking about, each pregnancy is unique in itself, and it is a poor assumption to believe that, well, I've done this before, I can do it all by myself again. It could be very different from pregnancy to pregnancy. It could be very different from your very own family members who's had children, and to really take a moment to look at what it is that you and your pregnancy is going to need. I had attempted death 3 times during my pregnancy. They were very serious. And so I want to be clear, not attempted suicide, but just because of the complications had resulted in near death experiences. So even though it would be poor to assume that everything's going to be the same for each pregnancy. So I just kind of wanted to throw that out there in the discussion.
Thanks, Brenda. And that is definitely the truth. There's so many things that can happen if you're a first time, if it's a first time pregnancy. I know my son and my daughter-in-law found that they each had a gene for cystic fibrosis and didn't know it at the time, and had the genetic testing. And I know supporting my son through that news was, what did I know? Nothing. I had to go to people that I could ask um, and help. And fortunately, everything has been fine. But those are, there's so many variables in procreation, I guess, that and there's someone out there to support whatever they may be. And if we don't know in ourselves, in our particular group, I think that we know someone who will know or might know someone who knows. So building that community is incredibly important. I've got a few more resources just in population health programs as well. And many of these are Brenda, are they on our website?
No, I don't think so.
I can just touch really briefly on a handful of them. Affect Therapeutics, just to let people give them a little bit more information, is a program. It's an app, member focused, regarding substance use. So alcohol, cannabis, stimulant, and opioid. Um, Substance use. And so it does provide contingency management, so positive reinforcement for members, so member rewards for achieving certain steps in their recovery. And it's app-based, so it's virtual. So for folks, especially in the North, we know alcohol use is um, a serious issue. And so this is a platform in which members can be supported within their recovery for substance use. Choose Tomorrow is a focus on suicide prevention. So that's through our care management department and outreaching members who have been identified at higher risk and assessing, providing various resources. The health plan has specific disease management programs, as you can see, that also provide support and resources in working with specific disease states. Halo is also a program where we identify individuals who may be at higher risk for substance use and do some outreach. Pix Health is a mobile app that focuses on isolation. So clearly during COVID and also in rural communities, that's such a concern for individuals, only further exacerbated for folks who might have mental health issues. So Pix Health is an app. I can probably put that information in the chat. We should have info on Arizona Complete Health's website about PICS and how members can get connected. And so we've seen some really great outcomes from people involved with PICS and that app. And really reducing loneliness, isolation, anxiety, depression go hand in hand. And so within the app, individuals can also connect with other representatives should they need additional support, resources for community. And so that's positive. Let's see, going down, we talked about Start Smart for Your Baby. WellFrame is also a mobile app that individuals can participate in care management through Arizona Complete Health if their preference is app-based, web-based. And so that's WellFrame. There is a specific track for pregnant members. And so through that, we can communicate via text and share information, appointment reminders, etc.
Awesome. And then Kate in the chat shared about Postpartum Support International, PSI, which is an incredible resource with free support groups. And they have a variety of very specific groups as well. And that is a good question. Are these programs and virtual meetings available with language support?
Is that a question about the PSI groups? Or if it is, I think they may have some Spanish groups, but I don't think, no, that many groups, unfortunately. I mean, maybe through interpretive services for like providers, but I know for free support groups, I don't believe that they offer interpretive services.
Okay. And he was speaking of the PSI groups.
That's a great call out too, just to mention as far as the health plan information that we provide, like Start Smart for Your Baby, we do have those resources provided or available in Spanish, or as well as larger print. for visually impaired individuals, and then um, a number of the information we also connect through interpreter services as well. Wow, that's good to know about
Oh,
Japanese and Russian. Those are
I know. Go
Mhm.
Luther. Um, and links to the resources, we'll put some together and make sure that Lori can send them out to everybody as well.
Deb, I just want to remind you that I don't have the email list to everybody that's on this meeting because it goes outside of NAPFC and APFC.
Oh,
So, they can go to the recording on the NAMI YouTube channel. And that's a good way to get resources. I can send the PowerPoint out to anyone that is with the APFC or NAPFC. I can ask NAMI Yavapai to send it out to their readership. But people that aren't involved with any of those, I don't have contact with.
This is
okay. Patsy, I think you started to talk and then you were on mute.
yeah. I don't know what happened. This is Patsy. I am running some notes, so if you drop your contact information in the chat, I can add that to those notes as well, and then we could have a list.
Thank you. And I am just going to put in a quick plug for the health equity through member and family advocacy and our OIFA advocates. We can meet with members and our families. Lori has reached out to me, reached out to Patsy, and other health plans as well, the OIFA teams, to help get them connected to the services they may be struggling to obtain, more information about some, and just support during health home meetings, etc. So we work side by peer supports and family support partners work side by side with members and families to increase access to equitable care. And this just shows, how internally we connect with the different departments. There really isn't anywhere we can't reach into. And here over on the other side are community relationships where not only if someone brings a member to any of the OIFAs, we make sure they get to the plan OIFA they need. That's why we work closely together as the Alliance and Access OIFA as well. And we're out in the community. We participate in coalitions and advocacy groups in the justice system with providers, community partners. Our community partners are invaluable to the health of our members. Interdepartmental, I mean, Danny, I yanked her out of a luncheon to help me get transportation for somebody who was who was being discharged and needed to go from Phoenix to St. John's, I think. And oh, I'm so glad you were there. Um, so that's, and then we work with quality management. I do special assistance for our SMI membership and making sure that they have an advocate, or if they have a guardian, that guardian is included in all aspects of their uh, of their care and decision in health behavioral health planning. And we work with care management, provider engagement, executive leadership hears from us on a regular basis. And so we're, we are definitely an entry into that. And I'm not going to say we're done yet because we've got some time. Is there anyone, are there questions people would like to ask? Is there anything you'd like to add to this discussion?
Deb, I would. I, we're we've been having some meetings about when the Medicaid cuts come into effect and how that's going to really affect our maternal mothers and our parents. And so we're starting to think about helping set up some volunteer work and a platform that can track volunteers. So maybe a mother with 3 young children at home, she's in recovery. Somehow her Medicaid gets cut. How do we help her to give her a place to volunteer that has logged in hours that we can report to Access that, yes, this person is meeting, either they're working part-time, they're going to school, or they're volunteering. And I just kind of want to get that out there as we're thinking about it in our service area. I just wanted to open that up because I just feel like somehow we can counter some of the effects by putting together some programs that people can do from home or, things like that.
I like how you think, Susie.
And it's gonna take the strength of the community to come together to really troubleshoot some things that are out of our control. What is in our control is that we have some advocacy, there's like different advocacy type programs or opportunities to get more involved with your legislation. But I think I always go back to when the pandemic happened and there was a stop making of masks. The community came together and used their skills. They sewed masks, not shared dirty masks, but like they sewed masks and donated them. And so I just think, imagine this is a scary time that's coming up, but imagine what could happen if we did come together and support one another with how do we get the volunteer hours? Um, are are the individuals that are being talked about, um, do they meet that criteria? Because there's some that are they I cannot think of the word, but they're expunged from the criteria. So if they hit this level, that means that they don't have to, nothing changes for them. But for the ones that it's going to change to, how are they involved? Are they involved in advisory councils, things like that? And then, how else can the community come together, which is, are there opportunities for volunteering? Are people looking into that? Is the community going to accept such things? And, all those other things, just, I really feel like it's the time for really creative thinking as far as this young mother, what can she bring to the table? What ideas does she have? And then how, herself, and then tapping into her community and calling to her community. This is what we need. This is the support we need. How can we make it happen?
Thank you, Brenda. Um, uh, I wanted to reach out to Carol Knudsen because we didn't have Trish here to talk about family involvement center so much, but it's about family support. And so just sharing a little bit about what family support does for a family.
We sit down with them, help them set goals. I've helped moms make like little charts for their kids to do jobs, encouragement, give them resources, help them get the food they need. Some of the moms that I am supporting actually got enrolled in an adult high school, just connecting them with resources.
Thank you. And I know that Family Involvement Center also has a program for dads, which as anyone who's had children may have experienced, I know that I did, was I started to really resent the fact I never could leave the house without just car keys again. And as a mom, and 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 how much that took, and how, my husband could. And it's, negotiating that kind of stuff too, that's just life. Um, there's a huge shift in the dynamic of the home with a first time pregnancy and child, and it's and it can be pretty intense. So I think there were a couple more things in here that I just wanted to share. Um, Health Start has bilingual community health workers, and DeNova also has a team of 25 case managers who work with access patients to connect to additional resources as needed. And we recognize that their mental health is not going to improve if they're struggling with basic needs. Amen. Total amen on that one. Um, and then Sabbath said we also have, and she was from the community, from the health department, community health, I believe. We also have a prenatal care program for uninsured individuals that is income-based for pay. And are these programs, question here, are these programs available for significant others or families? And yes. Do we have Lori?
Yeah, we've got just a little bit of time left. I'd like to know if there are any closing comments from any of the panelists, how we can help get the word out, or any any ideas to promote hope
Um,
solutions.
I just piggyback on that comment actually to say that here at Shirley Health, we know that the single biggest indicator of positive outcomes for all of our clients is the involvement of the folks that love them in their treatment journey. So we do offer programming for our clients through family therapy. It's family as chosen by our client, but that does include significant others and some support groups to address things. We've seen a big need for fathers as well, and so I think in general with hope and everything else, just inviting everyone to be a part of this outside of just the person giving birth, right? There's a lot of humans involved in the child rearing and also supporting and wrapping around that person that needs the support and love. So I think that's huge, and just seeing that full system. I know some of these programs referenced, like Health Start, Healthy Families, Head Start, all of those guys do a beautiful job of that, and that's just enormous. I always like to say, heads up, hearts forward. We're all in this together, and Medicaid's going to be tough, but we are
Yeah.
also, and we'll make things happen how we need to, and we see collective community action through this kind of thing. So I think I have hope, or I don't think I know I have hope, and look forward to being part of this in partnership with many of you on this call.
Thank you, Kate. Any other panelists have a closing statement?
I just appreciate being part of the panel and hearing from you all of the great programs and support you're providing as well. It literally takes a village. And so hopefully we can continue, conversations such as this and sharing resources and, just really working together to serve the community because there's a need and, yeah. So thank you for all you do as well.
I would just like to close that the Rural Health Transformation Program has a focus on maternal and child health. And so, as I will make sure and get to Lori the information about upcoming grants or programs that could be funded with some of those monies, if we want to join together and try and get a piece to help. But there is that focus on behavioral health, addiction, and maternal and baby children outcomes. So I'll keep Lori up to date with what I get, and I'm watching it very close.
Thank you for that, Susie. And the governor's office has been doing webinars regarding that, and they still have more to go. So check out the governor website and look that up. They've been very helpful, and I think that the recognition for the need is there, the recognition for the funding is there, and something that you're all saying is you have the recognition for teaming up together to make a difference. We can't do it individually. Andrea, you have your hand up?
Yes, thank you for acknowledging that, Lori. I cannot find my hand raised low and all that on my platform. Like over here, see my hand. I would like to think today of the awareness that has been going on for a while as far as the mortality rate in the African American people of color, the indigenous, that we are now talking about it. As we know, this has been going on, but the awareness is the first step. And I would just love to see what the next step is going to be collectively in Arizona to attack this problem, because realistically, there are already coalitions going on out there that are approaching this. Maybe we can bring them in on this conversation and have a team community Arizona effort that everybody comes to the pie with an ingredient, because it can be done, guys. And somebody said earlier about a system, and I have always said we need to build and create a system within our own system, because what's working now is not working. So I thank you. I thank you for that.
And
Thank you.
thank you, Andrea. So on behalf of the Northern Arizona Parent Family Coalition and NAMI Yavapai, our sponsor, Arizona Complete Health, I want to thank the panelists for being here today and thank all of you for being here today. With that, I will stop the recording.